Notice what causes heart failure and how to prevent it. Heart failure, known as heart failure in medical language, is a condition that occurs when the heart fails to pump blood in sufficient quantities for metabolic needs. Heart failure, if left untreated, will result in death. Therefore, prompt and accurate diagnostics should be enforced to obtain the best treatment. The occurrence of heart failure is usually triggered by health problems, such as coronary heart disease, birth defects, heart rhythm disorders, diabetes, hypertension or high blood pressure, cardiomyopathy or heart muscle disorders, damage to the heart valve, hyperthyroidism or overactive thyroid gland, anemia or lack of red blood cells, myocarditis or inflammation of the heart muscle. Based on the time span of development of symptoms, heart failure is divided into two types, namely chronic and acute. In chronic heart failure, symptoms develop gradually and prolong, while in acute heart failure, symptoms develop rapidly. The person who has acute heart failure should receive hospitalization. The main symptoms of heart failure include shortness of breath. The body feels tired. There is swelling of the ankle. In most cases, heart failure is a lifetime condition that cannot be treated. So in such cases, effective handling consists of a combination of drugs, cardiac support, surgery necessary. Healthy lifestyle is also important to be lived by patients. The effectiveness of the treatment of heart failure is not only the duty of the physician, but must also be supported by the cooperation of the patient. Treatment aims to relieve symptoms of heart failure, help the heart become stronger, allowing patients to live longer normally, reduce the risk of heart attack and death. Some things you can do to prevent heart failure include: 1. Eat healthy foods that contain lots of fiber, such as vegetables, fruits, wheat, fish, and meat, and avoid excessive salt intake. Apart from spinach, iron can also be obtained from supplements. Avoid foods that contain saturated fats, such as offal, goat meat, shellfish, egg yolks, and shrimp. Also limit sugar and salt intake. 2. Maintain weight on healthy limits and perform weight loss measures if needed. 3. Stop smoking for a smoker. If not a smoker, then try to avoid cigarette smoke so as not to become a passive smoker. Not consuming liquor. 4. Exercising regularly. Doing activities or sports that can make the healthy heart, such as cycling or walking, at least 2.5 hours per week. 5. Keep cholesterol and blood pressure at a healthy level, as both can increase the risk of heart failure. These are the steps that need to be taken by anyone who has the potential to have heart failure or a general person who wants to maintain their heart health.
Like and subscribe, like and subscribe, like and subscribe. Like and subscribe. Like and subscribe. Like and subscribe.